welcome to my little yoga room. So yeah, probably the most unprofessional yoga video that's available at the moment, but hey, this is me, I'm just working with what we've got. I was hoping to do a beautiful video outside in the sun. It is about 30 degrees today, with the swimming pool and the beautiful mountains behind me, but realistically that was just too impractical. So here I am in my my little yoga room, my little treatment room, and I'm going to talk about sciatica, okay, because lots of people this day and age suffer really badly with sciatica. It's a very, very common problem, and lots of people come into my class with sciatica problems. From experience, I know that there are certain yoga poses that really help with the sciatica. So sciatica can be caused by two different things. So firstly, it could be cause of the lumbar spine. So if you have a herniated disc in the spine, and that could be pressing out and squashing onto that sciatic nerve, right? And the second one, and actually I believe is the most popular cause of sciatica, is actually not to do with the spine, but to do with a very tight muscle here in the butt, right? The piriformis muscle. Okay, your sciatic nerve passes really close by that muscle. Sometimes it can even go through it. And if that muscle is tight, it'll squeeze on that sciatic nerve. You will still suffer with those same sciatic problems. So true sciatica is from the lumbar spine, but sciatic pain can still come from the butt here. So you're going to be looking at things that we can do for both of those. Now, first I came across a little tip to find out if your pain is lumbar or piriformis. Now, this is a little tip. This is not medical science, okay? So if you do suffer with severe sciatic pain, you do need to see your GP, and you probably need to be referred to a specialist to find out for sure where your sciatic pain, where the cause is for your sciatic pain. But this little tip I came across was quite interesting actually, and I can understand how this would work. So this would be laying down on your side with your top knee. This is if you're having sciatic pain down your right side, your right leg is on top, okay? So that's going to be on top and coming over to the floor there. So this bottom leg can be bent or straight out, doesn't matter. But your top knee, the side that you're suffering with the sciatic pain from, is going to be on the top here. And then to place something heavy, now it might just be like, not very heavy, small bag of sugar. In this case, I'm going to use this book, this beautiful book, Ashtanga Yoga by David Svensson, one that I do love very dearly. I'm going to pop that here on my thigh, and if you can lift your leg off the floor with that weight on without suffering that really horrible sciatic pain, it is probably, your sciatica is probably coming from your spine. If this is really difficult to get that leg lifted, because what we're using here are these external rotator muscles and these big muscles in the glute, if we're lifting this and these muscles are tight, it's going to squeeze in that sensitive place and you're going to have pain. So if this action is hard to lift up against resistance, the likelihood is that your sciatic pain is coming from this muscle here. Okay, but that is not medical science, that is just a little technique that you can try. So again, please go and get it checked out properly if it's a real, if you're suffering really bad. So first of all, I'm going to work on some postures, or we're going to work on some postures to relieve your sciatic pain if this is the problem, okay? And this is, we want to stretch these glutes, stretch this piriformis muscle, your hip flexor muscles, okay, coming all the way around. So your forward folds can feel really tight if you're coming forward. So we're going to work on stretching these muscles out for this, to release this piriformis muscle. So the first one is a very simple twisting action. So we're going to, if your pain again is on the right here, actually you would always do it both sides, because you don't want, even if your problem is on the right, you do want to balance left and right. So it might be just that you focus more or hold stretches longer on the side that is a problem, but you will always do both sides. So I'm going to take my left leg out straight, I'm going to bring my right foot in nice and close, and then crossing the right foot over the left leg there and hugging that knee into the chest. Now just this little action here, you might feel a big stretch that goes down the outside of your thigh here, and it might even come around your hip. Okay, so this is your great stretch for your first one. You want to add on to this a little bit more. We're going to lengthen up through the spine and we twist towards that bent knee. So you twist from the belly, the waist, the ribs, the chest, the shoulders, and if it feels okay on the neck, you can look over that right shoulder there, that back shoulder. So taking this nice twist in. This is not essential for this release of this muscle, but it does help lengthen these muscles in the spine and all these connecting muscles here. Okay, so this is your first little posture to see, and if it is a result of sciatica through here, this is going to feel like a bit uncomfortable. Okay, so that will give you another indication of where your sciatic problem is coming from. The next stage for here, now this is a little bit complicated, okay, so, but we're going to do this as we're sitting on the floor here now anyway. So we're going to take your left leg underneath your right leg. Okay, and it might mean that you're sitting on your left bum cheek a little bit, or your left hip, and then you're going to take your right foot over your left foot. So we're in a similar position to what we've just done. So your right foot has crossed over your left thigh here. Okay, and now you're going to try and get both butt cheeks on the floor. So at the moment I'm toppling onto my left side. So I'm going to try and bring my right bum cheek down towards the floor. So you don't want to be sitting too much on your heel, so this is going to take a little bit further away. Then, if you can, and always as well thinking about your knees. So for some people, your knees are not going to be want to be in this position, particularly this lower knee. So if that's the case, then we leave this posture alone. So you never want to push through pain when that pain is associated with your joints. Okay? But if we can, if this is still feeling okay, you're going to start to maneuver this foot a little bit further back. So ultimately, we want the top knee on top of the bottom knee. So I like to take a little wiggle and move. I kind of shift it and cross my legs really high at the top and then place my bum back down on the floor. Now you might need to use a little cushion or a blanket underneath your bum to lift it a little bit higher. So I'll show you what we're going to do here. So, excuse me for coming so close to the camera right now. Hi. Okay, so I'm going to take a little cushion here. I've crossed my left leg under, right leg on top. And it's going to be really uncomfortable to sit on the floor, so I'm going to lift myself a bit higher. I've now got contact, both bum cheeks, both sit bones against the blanket, and these feet coming back. So in your perfect yoga pose, this is part of Gomukhasana, okay, it's called a cow pose. In your perfect pose, you will have both knees sitting right on top of each other. You'll see I've got a little gap here. And both feet right in line with each other, right next to the hips, okay? But it's not called yoga perfect, it's called yoga practice. So we work with our bodies. As well, if your hips are really tight, this is going to feel super strong. Okay, so eventually you might be able to take that blanket away and come all the way down onto the floor. Okay, I can really feel this now right along the IT band area, right up into the bum here around the hips. Okay, so again though, if you get pain in your knees, and please don't ever think, oh, this feels like a good stretch around the knee, right? Knees don't want to stretch, so that is not good. Okay, so let's take this away. The next one we can do, and this is a little bit simpler, much simpler actually, and it is really, really good for opening up here. So we're going to lie on the back, and the feet are on the floor, knees are bent, and you're going to take your right foot across your left knee, and you're going to let your right knee drop out to the side. So when I say foot, right, what I've got here, I'm just taking the outside of my ankle and the outside of the foot onto the thigh there. So some people I see, and they kind of crossed halfway up the calf muscle, or the halfway up the shin. So the closer you can get with your foot on there is going to make your hips open a little bit wider. So I'm going to come back to the right side there. So right ankle on that thigh, left ankle open, left knee open nice and wide. This is going to stretch through that hip and it's going to stretch the inside of the thigh there, but we want this muscle in the bum. So then we lift the left foot up off the floor. If you can, you take hold of it with the hands and you pull it as close as you can. Okay, this is a super, super stretch. And again, I'm really feeling this all along this area that we need to stretch out to release that sciatic nerve. So we hold this into the chest. There are a few variations of this posture that you can do. This is probably the simplest one. The second one, to get into this without, if you're struggling to hold your thigh in place here, it's really great to use a wall. Okay, I'm not going to turn around here because then all you'll see is the top of my head. So imagining that my feet here are against the wall. Okay, so I've got my bottom near the wall, my legs are up against the wall. Same action, I'm going to cross my right foot over my left thigh, just above the knee. Okay, my left foot is still against the wall here, use your imagination. Okay, and then as I start to take my left foot down the wall, it is automatically going to bring me closer in. However, be careful, if we do this, you want to keep your tailbone down on the floor, because again, I see people moving in and this starts to happen, lifting the bum off the floor. Okay, so, but it is such a deep stretch if you do this against the wall. So both legs start up against the wall, you cross one foot over the other thigh, and then you start to slide that other foot down the wall, and it is going to automatically bring this shin closer to your chest and take that deep stretch right here. Super, super stretch. And you're using the wall for support. Okay. The other way, and it's exactly the same position that we're putting our body in, and also we're going to use the wall, is to sit against the wall. Okay. Now, I once had a yoga teacher back in Liverpool. I didn't see her regularly, used to go to some workshops, and I picked up great tips from her. And she used to do this every morning with a cup of coffee and a newspaper. Right, this is what she did. So sitting, and this is a great, great hip opener, but also getting to that place. Sitting against the wall, so you've got nowhere to go back to. It's like your back being against the floor here. Again, you're going to cross to the same position. We've crossed the right ankle above the left knee, so you don't want to press on that knee joint, it's on the thigh. And then you start to take your left foot to the floor and you bring it closer and closer and closer. Wow! Okay, so it's deep. It gets really deep into that glute, really deep into those little muscles, and it's massive hip opener. So this yoga teacher used to sit there every morning like this, reading a newspaper, having a cup of coffee, and then obviously changing sides. So again, we've got the wall here, so you can't shy away from this stretch, but work within your comfortable limits, okay? So don't force, don't push through pain, recognize how it feels in the joints, okay? And if it just feels like a super, super, super stretch, then all is good, but no popping, no snapping. If something doesn't feel right, it probably isn't right for you today. It might not be right for you tomorrow or next week, so work carefully, work with your body. The last one that we're going to do we've got two more to do actually. We've got two more to do. So I'm going to go back to the position that we've just been in, right? I'm going to take it from the other side. Because once we've done this here, we've got a great way then to stretch out the IT band. So we've taken the right foot over the thigh, we bring that thigh in, we give it a little hug, we stretch out that muscle, then we take our left foot back down to the floor, keeping this right knee open, keep the foot glued to your thigh, both shoulders stay on the floor. You're going to let your left knee drop down to the floor towards the left, and your right foot doesn't move, your right foot's still attached to it until eventually it might come all the way to the floor. Now again, for you, you might need to use a little rolled up blanket or towel, so you might not be able to get all the way to the floor, so you're going to come over and rest your thigh and your foot on that blanket there.
Okay, again, what happens often is we get down there and this knee collapses. So you want to bring your right knee as far away from you as you can. Now that is where the magic happens, okay? So once we've start pushing that thigh away, you might feel a big stretch again of this IT band. So your IT band connects the back of your hip to your lower leg, okay? It can cause a lot of problems if it's tight. Both shoulders are on the floor, so we get that nice spinal twist. But again, if your sciatica is from a herniated disc in the lumbar spine, please be really, really gentle with your twist, because you don't want to overdo it there. We come back to center, we change sides, and obviously we do it the other side. Okay, exactly the same. So again, foot comes over thigh, we bring that left foot into the chest, we hug it in nice and tight to get this big stretch in the butt. Then we take the left foot to the floor, and with the right foot still attached, we come all the way down, well, as close as you can to the floor. Right knee pushing away from you to get that stretch. Okay. The last one we're going to do here is called pigeon pose. Now, I'm not sure how this is going to look on camera, which side is going to be better. Okay, I'm going to do, I'll do both sides so you can see from both angles. So I like to start my pigeon just from being on hands and knees, okay? And again, this is the right side we're going to be working on. So your right knee is going to come to the back of your right wrist. And then your right foot, you can take hold of it with your left hand and swing that leg around. Now what you don't want is to have your ankle and knee in line with each other. There are some pictures of beautiful yogis doing this posture with this in line, and it looks amazing, but it will have a big effect on the knee, okay? So all times your yoga practice is to keep you safe, not to harm yourself, okay, and not to look pretty. So your knee, the further out you can take your knee to the side of your mat, the deeper you're going to get this stretch. My right foot here is more or less down by my left hip, okay? So my knee is up by my ankle, but my foot is down by my hip, and your foot is flexed. Okay, you don't want to have pointed toes here, because again, this can affect the knee, okay? So I'm going to tuck those back toes under, lift the knee, and I'm going to shuffle that back foot away to bring my hips a little closer to the floor. The knee comes back down, and then I'm going to turn around and look at that back leg and make sure that leg is straight out behind and it's not going off to one side or the other. This already is feeling like a massive stretch, and again, your knee might not want to be in this position, so please work carefully. If we're here and it's feeling okay, and this will take a little practice to get into, you can start walking your hands forward. Maybe you can come onto the elbows. Maybe you can bring your chest all the way to the floor. And you can stay there. You can stay in any of these postures actually for as long as you want. So don't rush into these postures and don't rush out of them. Okay, really important. So if you rush, you won't feel your stretch. If you come out of them too quickly, your stretch won't have any benefit. So stay there in these poses for at least 30 seconds. Okay, if you can take it to a minute, that's fabulous. If you can take it to 2 minutes, that's great. But you'll start to add on time. As you start to stretch, your muscles will start to open and you'll be able to stay in those stretches a little bit longer. Okay, so that is our stretches for the piriformis muscle, and for the IT band, and for these muscles in the butt that squeeze onto that sciatic nerve and cause problems here. I'm just going to go for a couple that will help with sciatica caused by the lumbar. Now, our main one is cobra. So we want postures that are going to lengthen the spine, that are going to create space between each vertebra so that disc can go back into place rather than being the vertebra being squashed and that disc getting squashed out. We want to create length in the vertebra, length in the spine to create space for the discs. So our cobra is one, it's used in a lot of physiotherapy actually for rehabilitation for back problems.
So lying on the floor, but the first thing we want to do is have a long, long spine. So I personally like to kind of crawl my rib cage forward, and some people walk their hips back. We want it feeling long, okay? Now, often when we do Cobra, people feel like a little contraction in the lower back, a little squeeze in the lower back, which is not what we want. So because when they lift up, like, oh, compression there in the spine. So the tip that you want is to press the top of your thighs, your groin, your pubic bone, your lower belly down into the floor. Okay, just by doing this action, you will see that my chest is already starting to lift. Now, there's a little contraction in the bum, but you don't want to squeeze really tight. Okay, we're not trying to crack any nuts in the bum cheeks here. All right, so it's just a little contraction as we press into the floor. Now, for those of you that do have lower back problems, please keep your legs a little bit wider. Okay, if your back is relatively healthy, and if it is, you're probably not going to be watching this video. But if it is, your thighs together, your big toes together. Okay, but lower back problems, keep those legs a little bit wider. So we're pressing into the floor, tops of the thighs, lower belly, front of the hips. Hands come down next to the chest, and the neck stays nice and long. We're just going to use mainly the back muscles to peel the rib cage off the floor. Now, often I see this, whee, all the way up here. Shoulders are up, we've lost our neck, we've locked the elbows. Okay, great if you can get up here to increase the flexibility in the spine, but it's not what we're looking for today. We're looking to strengthen and lengthen the spine. So we're pressing into the floor and we're lifting up. A little pressure into the hands, but it doesn't need much. And the neck stays nice and long. Okay. The other pose we can do while we're down here is Shavasana. So it's our locust pose. So again, we want really long body, really long spine. We're going to keep the pubic bone and the front of the hips down into the floor. And we're going to lift the right leg off the floor. And instead of trying to create height and coming over to one side and lifting the hip, lift it up and think about creating length. Push away with those toes. We take it down, we lift the other side, we push away, take it down. You can rest the head on the floor, we can just lift the legs. And if this is feeling okay and your back is getting stronger, you can start to go to the next level, which is opposite arm, opposite leg. So we lift the right leg and the left arm, can push into this right hand here to get you a little bit more height. But think about length, think about really reaching away with your fingertips, really reaching away with your toes, and we come back down. On the left side, we lift the left leg and the right arm, and we stretch and reach away, creating length in the body, length in the spine. And we come all the way down. Okay. So we have 2 more to do for your spine and your legs. Okay, so first of all, while I'm still on the floor here, hamstring stretch. Okay, if you have any problems in the spine, particularly lumbar spine and disc problems, herniated discs, forward folding, so try and stretch your hamstrings. These forward folding type stretches, either sitting or lying, can be quite harmful for your back, okay? But what we can do to stretch the hamstrings and keep the back straight and keep the back safe is to do this laying on the floor. So you can come down onto your back, and you can keep one foot on the floor, keep one knee bent if your back is uncomfortable. You lift the other foot up to the ceiling. You can take hold of the thigh. So we want to stretch, so we don't want this knee all the way in and not being able to lift the foot high. So we're getting no hamstring stretch here. It's better that your thigh is away from you and you're pushing through the heel. So look at my foot, if it's still on camera, it might just gone off camera. So my toes are coming down towards my face, my heel is pushing away. Get a nice stretch up the back of the leg here. Now, if you can't reach your thigh or your calf, you could get a belt, so it just needs to be a soft dressing gown belt, and pass it over the toes and use that to hold on to keep that foot in the air, so you don't have to sort of try and struggle to get up to the leg here. So that belt would just go, and I should have thought about this in advance and brought one, but never mind. That belt will just go across the back of the foot, the ball of the foot, and you take hold of it, and you can just rest onto that belt there, and slowly you can bring it closer, 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 until your foot comes all the way overhead to touch the floor. Maybe not. Okay, so this is going to be great to lengthen out your hamstrings. Again, remember your hamstrings go right up into your butt here. So we want to create long hamstrings, long spine muscles, and muscles in the bum. So we've got one more posture to do to lengthen out the spine, and we can use the wall for this, but we're going to come up into standing. Okay,